As part of effort to mitigate the challenges of polio and promote collective action towards polio eradication in Kaduna State and Nigeria at large, the Kaduna State Primary Healthcare Board, in collaboration with the United Nations Children Fund UNICEF and the World Health Organization WHO, has organized a media dialogue meeting on polio with journalists and on-air personalities as well as social media influencers on polio campaign in Kaduna. The media dialogue was aimed at discussing the impact of media coverage and how it can influence public opinion and attitude towards vaccination. Speaking at the event, Dr. Idris Baba, the officer in charge, UNICEF Kaduna Field Office, said despite concerted efforts in 2024, circulating polio type 2 or polio variant type 2 transmission persists, while detections fell from 166 in 2023 to 122 in 2024. Children paralyzed by CVPV2 have risen from 86 to 98 in the last 3 years.
Absolutely, you know that media is one of the most vital and most powerful tool of communicating and sending information out to the community. So the role we expect media to play is to ensure that the right information is packaged and gets to the community. You know, you have a very wide base in terms of listenership. Looking at both the radio and both the print and the electronic media, you have a very big listener base. So the same thing with the social media influencers. We have them so that even the young people can also be part of the conversation. We don't want to leave anybody behind. Of this engagement, we expect the media to be more open doing in terms of coming up with information, programs and materials that will mobilize the people, ensure that the right information get there, and people are mobilized to do the right thing in terms of taking the right action so that they get all their children immunized. One thing we expect also is for the media to engage with the community directly, give them the opportunity to ask questions, give them the opportunity to interact with the experts so that the people's myths and misconceptions will be clarified so that we will do the right thing for our children.
Other speakers at the event were Tessa Rintala, Health SBC Specialist, UNICEF Abuja, Grace Sidiku, Rotary Polio Field Coordinator, and Dr. Abdullahi Musa Garba, State Incident Manager, Kaduna State Primary Healthcare Board.
So the message that every single child under 5 years of age should be vaccinated during this campaign needs to be drummed to all our audiences. And you know best how to communicate to your particular audiences. So you as communicators know that copy-pasting the message does not work. You need to tailor-make it to speak to your audience. So I'm really happy that you are here to discuss this together.
So the people that we are invited, knowing fully there are a lot of interventions that we are doing at the board, especially in the area of immunization. But these people did not have the first-hand information, or they are not having the first-hand information about some of these things that we are doing and even why we are doing all these things. So we think it's very necessary for us as a body, the State Primary Healthcare Board, in collaboration with our partners, to bring these people together to give them the right information.
The media dialogue ended with a commitment that the embarrassment must end and our children must be free of fear of this deadly virus and other vaccines preventable diseases. The continuing spread of the variant polio viruses in Nigeria needs to end by 2025.